All right, so for the knee special tests, we have several of them. The first ones that we're really going to talk about are going to be our Valgus and Varus tests, because we talked about the MCL and the LCL first. And when we talk about those, remember the MCL is going to be this medial ligament, and then the LCL is going to be this lateral ligament out here. So when we do these, we need to do these tests two different ways, and this is important, you need to know this. The first way that we do it is with the leg totally straight, so we need it to be flat, okay, in full extension, and then we're gonna do it again with the knee flexed to 20 to 30 degrees, no more than that. When we assess it when it's straight, we're assessing the capsule. Remember, all joints have a capsule around it to help give them support, and then when we flex it a little bit to 20 or 30 degrees, we're assessing the ligament. So we need to make sure that we do it in both positions, so that way we're knowing, is it a capsule injury, is it a ligament injury, or is it both? Because if it's both, it's going to be much more unstable, and we're going to have to think more about surgery or really pushing it on rehab, or how much time do we need to take off, or do they need to be on crutches and a straight knee mobilizer, like what's going on and what do we have to do to kind of fix this stuff so that way they're not going to be getting messed up. So I'm going to have Charlie slide my way just a little bit. I promise I won't let you fall off the table. Okay, and so the first thing we're going to do is going to be the valgus stress test. So remember I said valgus forces, I'm pushing from the outside in. I'm going to compress the lateral side, and I'm going to stretch, put tension on the medial side. And so what I'm going to do is we're going to be here, and you need to tell them really, really, really relax. Relaxation is important. Also, it's really difficult, okay? If you guys have ever had anybody do this, I'm miserable. My athletic trainers used to yell at me all the time. So I'm now the athletic trainer that yells at everybody to relax. There's a couple ways to do this. This is my favorite way though. It's going to depend upon the size of the person, the leg, your strength, your height, and everything else to make this happen. But you need it to be relaxed. And then what I do is I just say, okay, and we kind of come down as straight. And if you can, you want to put your fingers right over the ligament. And then I take this hand, because I'm going to push in, and I'm going to push in, and then I'm going to, with this elbow, squeeze in, and I'm going to lean my body a little bit so that my hands don't have to do so much work. I can actually use my body to open up his ligament. Well, actually, remember we're testing the capsule right now. And it should move a little bit, but it shouldn't move very much, because our knees have a little bit of motion in them, but they shouldn't be crazy. And then we're gonna bend it to 20 or 30 degrees, and it's not as much as you think. Like, don't be all the way up here or anything, okay? So we're just kind of here. And then we're gonna do the same thing. And now at 20 and 30 degrees of flexion, now we're testing the ligament. So we're testing the MCL, and we're gonna do the exact same thing, and he stops real nice. Have you ever hurt your knee before? No? Yeah, I can tell, because he has like a very hard end feel, and it's not going anywhere, okay? So then we flip it to test the LCL. So does everybody remember what test that is? It is the Varus test. And when we do the Varus test, we're gonna put our force on the medial side, and we're gonna try to put compression here and traction on the outside, and so we can open up or stretch that LCL ligament. Now, hurting the LCL is not very common. We don't hurt this one very much. So again, hand on the inside, because we're gonna push out. My thumb usually sits right on the LCL so I can feel if it's moving. And remember, when we're straight, when we're extension, we're testing the lateral capsule. And I'm gonna push in, and then you can't really see it, but I'm actually rotating my body a little bit into him to make it happen. And again, super solid, there's really nothing moving. I'm actually moving my body more than his leg is actually moving. And then I'm gonna bend it up to 20 to 30 degrees. And I'm gonna tell him to relax, because he's using his hip flexor and he's cheating. There you go. And we're gonna do the same thing, and I'm gonna push with this hand going that way, and then I'm gonna rock my body to the side and see if I can get it to open at all. And super solid. There is no laxity in this thing. And he doesn't report pain, right? No pain. So we have a 0. There's no spraining of either one of these ligaments, which is good, because otherwise I feel really bad doing this. So again, MCL is valgus, LCL is varus stress, and that's the same thing as when we talk about genu varum and genu valgum.